this is Dr. Wells with Wells Medicine, and I wanted to briefly discuss diet as it relates to mental health. So the diet that I encourage all of my patients to have is a very unprocessed, very rich and colorful diet, very varied, to try to incorporate as many healthful plant foods as possible. And the reason for this is there's great data now showing that ultra-processed foods, foods full of artificial colors, flavors, preservatives, foods really, grown with herbicides and pesticides, those all have toxic chemicals that can really interfere with the healthy way that our brain processes information and the healthy way that our brain supports our mood. So a key component of healthy eating is the vitamins and the minerals that come from our foods, but it's also avoiding the foods that cause inflammation. So some of the herbicides and pesticides, some of the artificial colors and flavors can cause inflammation in the body, and inflammation often looks very similar to depression. It can cause fatigue, amotivational states. It can really decrease that dopamine that we get from activities. And so, the more highly inflammatory the foods, the more it's going to have a mood effect. So anti-inflammatory foods are going to be your fresh fruits and vegetables, anything very richly colored like blueberries and red bell peppers. Those are going to have the highest levels of those potent anti-inflammatories. Similarly, very colorful spices like turmeric and ginger, cayenne. Those are going to be potent anti-inflammatories that are going to help support a good mood and help decrease overall inflammation in the body. Those colorful fruits and vegetables are also going to be where you're going to find magnesium, zinc, calcium, vitamin C, and those support a healthy mood as well. The more processed a food is, the more those vitamins, minerals are taken away from it, and the more inflammatory that food is going to be for your whole system. So there's a great book called Your Brain on Food, and I love recommending this book to people because each chapter focuses on a different mental health need. So whether it's ADHD or whether it's anxiety or whether it's PTSD or whether it's depression, each chapter really focuses on different nutritional needs and different ways of supporting that mental health need with different dietary processes. All of them really relate to an excess of simple carbohydrates and an excess of insulin spikes and hyperglycemia, which is where there's too much blood sugar. And that can cause real significant mood effects with anxiety, with depression, and even with PTSD. Diet can affect our sleep, our ability to get rest. You'll see that often with recommendations to not eat too heavy right before you try to go to sleep, and to eat certain specific foods within a few hours of going to sleep. For example, cherries contain melatonin, a little warm milk with a little protein, as opposed to eating something very heavy in carbohydrates like cake right before bed, which can cause insulin spikes and cortisol release and decrease our restful sleep. But similarly, too high blood sugars or too low blood sugars throughout the day also can feel really unsettling and can lead to anxiety states and brain fog and fatigue. So a lot of patients now can see this data, whether they're wearing a continuous glucose monitor or whether they get their hemoglobin A1C checked at their primary care doctor. But to know whether or not you're eating a diet full of healthy, colorful vegetables, fresh, organic fruits and vegetables, that can really support a good mood. And some people will even, take pictures of their plates and post them to groups, just to kind of show off and brag on how colorful and fresh their food is. And I love that because it also gives you kind of an accountability and a way to look forward to and enjoy eating things that aren't so highly processed and full of substances that just give us a quick fix, rather than supporting our entire body with nutrition. So I really do encourage patients to eat any kind of diet that provides them whole unprocessed foods, staying away from artificial colors, flavors, preservatives, and try to eat organic when possible. A lot of patients will ask me, do I recommend vegan or keto or Mediterranean diet? I recommend whichever one is easiest for you to follow. But definitely, the more plants you can eat and the more unprocessed, the better.